So hello, good afternoon, hello, good morning in Japan, right? So we have a nice case today, another nice case. I showed early the new device from Creo Medical, the new speedboat. I don't know why I don't remember the name of the boat, but it's okay. So today, now we have a very nice case. This is a ¿cuántos años tiene el paciente? This is a 68 years old male with a history of acute pancreatitis with complications. Now the patient have a big pseudocyst after the pancreatitis, and he having now fever, vomit, not food tolerance, and also the procalcitonin is very high. So I believe this is an infected pseudocyst. So this is a big situation. It means we need to do the right things to try to save the life of this patient. So for this case, I want to make it in a very good way because I need to have first than all, I want to make a culture. I need to do a culture. This is not just to drain and that's all and we come back or we will do something. No, we need to make a culture because this is very important step as a first step for the physician that is in the intensive care unit. So if we can, identify any kind of, bacterial that is resistant, so they can adjust the antibiotics. So he have almost 3 weeks in the intensive care unit, and he was sending to us now for doing this drainage because he was not doing well. So now I am using a standard needle. Okay, so it's very important that you see if there is not vessels. So I don't see vessels here, and I can use DF5 sometimes. You see, there is not vessel, so I'm sure that I'm not in a bad place. And now I will use my needle because I want one to place well my lamps, and second to make a good aspiration. You see, but this is not pus, huh? I don't see pus. I see more blood. Well, we will send this. So this is a necrotic tissue for sure. So you can see this white area. This is because of bacterial. I'm sure about that. This is air. So, and this is the first time that we, try to make a punction here. So, for sure it's because of that. So now, necesito aspirar de nuevo. En otro frasco. Eso para cultivo. You can see it's bloody, huh? Yeah. Now it's coming pus. I think I am in a better place now. Oh yes, you see? So you can see now it's pus coming. That's why. You see? I think this is the best area. Esto también para cultivo. Ahora necesito solución salina y un poco de contraste. So the patient have already an ERCP. I don't know if this is. ¿Esto fue después de la CPR que hicieron allá afuera o qué? Ellos le hicieron CPR después de la pancreatitis. Tiene un stent. Ah, okay. Oh, okay. So I'm sorry. Was Dr. Alcivar made it. Okay, now un poquito. I will put a little bit of contrast. I want to see the extension because I can see this pseudocyst. You see, it's very big, and I can see him. It's no hay nomás. Solución salina. I can arrive to see it from Uno de 15. Dame una guía. From the head. So I believe there is a communication between the head and this pseudocyst. So that's why we can see it. So maybe a double drainage will be more effective. This is a publication made by Dr. Varadara Julu, showing that it's more efficient than doing just, you see, very well. Okay, now, why I am doing this? Why I am using the guide wire? This is a very difficult pseudocyst. This is not a normal pseudocyst. It's a big pseudocyst first. Second, I want to be, you see, if I try to do it without, probably I was drain it, I don't know, the coag or something like that, or some kind of bleeding inside, and not the part that I need to do it, that is the where the fluid is, right? Which is much interesting. Sí. So I will use a luminal apostle metallic stent of 50 millimeters. So stay connected with us. I hope to see you soon in Colombia, but also it will be very nice to see you during Endoscopy on Air 17 July. That is that will be focused Endoscopy on Air Americas, that will be focused on new devices, or how to access to polyps. You know how we made the polypectomy or mucosectomy or underwater technique. So we have a very nice panel of experts. I feel like I am a small boy with them. So you have Dr. B. Muller, do you have Dr. Douglas Rex and others, participating of this nice live transmission for free. So please stay tuned. We'll show a little bit about, new AI for colonoscopy, which I believe will be a nice tool for the future. So you see, this is why it's very important sometimes to have your guide wire, you see, because the position sometimes is difficult, and if you lose like the way to go inside, so it could be very, very difficult. So again, I review, there is not vessels, so I'm okay. So I went until the end because I want to see it, you see, very well. So now, even if I don't have my space, I need to open in this position. You see, I don't have like 1 centimeter, because I need to open very, very down. I need to open in that part, in that place, because I need to have a good drainage. You see now? Now I am very sure that I am in a correct place. And now I will make my pull back here. Ten aquí. Un poquito más. Okay, so now you can see this is very important when you are doing lamps as hot axios. You can have this angulation. This is very important to know that you are correct in the correct place to deliver it. So now I deliver it inside my working channel, where I know now that I am sure that I can deliver it. You see? Very good. You can see now the endoscopic image. Podemos ver la imagen endoscópica. And you see, I am not having bleeding first, because my first punction I had bleeding, right? And now I have just drainage drained the pus. And now what I will do now is less my guide wire inside, and I will pass, necesito un esfínterotomo. I will pass one sphincterotom, and then I will pass oxygen water, to be honest, okay? Why? Because this will help to clean up inside. And I will flush inside. So I will clean up and I will pass one antibiotic inside, trying to see if we can recover faster this patient, right? This is very important. So, and then I will try to see how is the collection from the head, because if the head is okay, I don't need to use another more. You see? So my lamps is in a good place. I can make my aspiration, but now I want to flush with saline, flush. Tenemos agua oxigenada. Very good papers using this before instead to make a necrosectomy. So I prefer to don't move too much the patient. Overall, that this patient is in a intensive care unit, so I believe it's a risk patient. We can come back again and do it whatever it is necessary when the patient is outside a critic situation. So now, that's why I less the guide wire. That's why I use it in this way. So I believe we learn how and when use the guide wire with lamps, right? So that's why I like it. I like it. That possibility, I think, was one of the best stents developed and invented by Professor B. Muller. Then, so now I am going inside. You see, I'm going very deep. Deja ver abajo. Okay, ahora quiero que la vemos con agua oxigenada. So I'm sure this is the dental part, so I'm sure this is a communication that we have with the head. So now we will clean up. Sigue. ¿Duro? Ah, okay. So I was asking if it was hard. She said, no, I'm going to the gym all days, so don't worry about that. No? No, she didn't say that. She just said that the syringe was too big, so that's why. Now she's using the worst one. Okay, yes, no creo que esa sirva, Raquelita. Hay que usar jeringuillas de 10 nomás. Huh? So 10 cc syringe, I believe, is better because of the pressure. So I believe the gene is not working. The gene is not working. Okay, so now we are flushing. Okay. So now I'm trying to put more in this area. Sí, claro, obvio. And then you less. The stent will make his job. You know, in these cases, I don't make any dilation. I make that the stent make his job for his own. I will just pass one gastroscope. Préstame una ampolla de gentamicina diluida. También. So I will pass gentamicin solution a little bit down. Then okay, ahí. So then, with that flush, probably will help us much. So, tienes más todavía, ¿verdad? Ok, un ratito. No, 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 todo. Ok, aquí, po. Ok. Ahora dame más agua oxigenada. Una más. You can see. So, I believe we are doing a very good job now. Very good. Muy bien, sigue, sigue, sigue. Ok, listo. Retiramos todo. So now you can see all the fluid is coming out. I will exchange my scope. I will use just one gastroscope. Just I need to see how it is the head. Now, you see? So, yo creo que era lo mismo, ¿ves? So the stent is well placed. You see, the stent is there. So that's why I believe it is okay. It's not necessary more than one in this case. Now we're on the ball. We can see here. Yes, it's okay. So it's okay. I will wait. I believe just one will be okay. So I believe in 24 hours he will be much better. And I will just make an aspiration. Okay, I will cut the transmission. Thank you so much.